Hi, I'm Dr. Nicholas Kapitanakis. I'm a board-certified OBGYN, and we're going to talk about VBACs today. One of the questions I get are, why are VBACs such a hot topic? It's kind of interesting. VBACs have become a hot topic. With a C-section rate over 30%, you can imagine 1 in 3 women that are walking in my office could potentially, fall into that category. So it becomes a hot topic. 30% of women are thinking about it, talking about it, and wanting to understand more about it. A VBAC is a vaginal birth after a cesarean section. I'm lucky enough to practice in a hospital that allows moms, or is able to have moms have a trial of labor after a C-section so that they can obtain that VBAC, or that vaginal birth after a C-section. So it's become a hot topic because so many moms unfortunately fall into that category. First and foremost, I try not to have a lot of VBAC moms, and air quotes. I try not to do the first C-section. That's what we should be talking about. We should be talking about how to prevent that first C-section so that we can ultimately decrease that cesarean rate nationwide and ultimately have fewer moms having a trial of labor. That would be my first and foremost goal. And here at CAP Women's Health and CAP Wellness Center, we are trying to do that, and we are very successful at doing that. My C-section rate, my primary C-section rate, is roughly around 10%. It's almost in the single digits. Part of that is patient empowerment. Not to go too tangential, but a successful VBAC, the base work of a successful VBAC is having a provider who is, in air quotes, VBAC friendly. Not somebody that necessarily is VBAC tolerant, but somebody who's VBAC friendly. So what does that mean? What does it mean? It means a provider who is going to empower you. It means a provider who believes in the process. It means a provider who is going to give you the tools to believe in your body. Now, it all depends. You have to be a good VBAC candidate per se. There are some contraindications, in your OBGYN and provider will go through that. But for most moms, they are a candidate for a vaginal birth after a C-section. So it's become a hot topic because so many moms need to talk about it. We know that the safest mode of delivery for most is going to be a vaginal birth. So of these 30+% of moms who've had these C-sections, we still believe that the safest route is a vaginal delivery. Again, for most. And I'm going to talk about the most of the women in general, not those few percentage points that maybe shouldn't try because they have a contraindication. But for most moms, a trial of labor is a great option. Tools to help those moms succeed include finding, again, a birth provider who is going to truly be a VBAC supporter, finding a birth team, and it all starts with education. We've created a VBAC course specifically for moms who've had prior C-sections. In the course, it's really about processing what happened with your first labor so that you can try to avoid some of those pitfalls and dealing with the psychological issues of birth. Sometimes that trauma from birth prevents us on that second attempt or third attempt to really truly release and believe in your body. And I need you to be 100% if a trial of labor is going to be successful. I need you to really feel comfortable with the process and trust your body. And that's what we do. It's all about patient empowerment through education. We also have an excellent ancillary team that is part of the Wellness Center. We have an amazing chiropractor. We have amazing acupuncturists. We have massage. We have everything that's going to provide you the necessary tools to feel and believe in your body. Education, again, is courses that are going to give you different techniques we call comfort measures to allow moms to experience early labor and all of labor and feeling comfortable, to enjoy your pregnancy, to not be scared of it, to understand it, understand your body, understand the process. Really, fear it drives a lot of the negative connotations with birth. And we want to wipe all that away. We want to make that the most amazing day of your life. I have 3 children. My wife delivered all 3 of them unmedicated, and she will say that she had 3 pain-free births. She will tell you that the best days of her life was the delivery of those kids because she went in without fear. She truly enjoyed the process. Not saying every woman is going to enjoy the process, but you should feel empowered and love what your body can do and trust that your body can do it. Yeah, there are times when you will need medical interventions for those rare few emergencies. But for the vast majority of women, if you let the process go, it's amazing. And you can be successful.